All right, so we have mitochondrial diseases and the United Mitochondrial Disease Foundation. All right, so mitochondrial diseases are genetic diseases that affect the function of the mitochondria, which most of us know are the powerhouse of the cell. They supply energy to all the parts of our bodies except for red blood cells, which don't use that. The mitochondria is an incredibly unique organelle that has its own genome and DNA. The mitochondria has a separate replication process for cell mitosis, but it still relies on cell DNA for instruction. There are hundreds of different mitochondrial diseases, and they can be inherited either through the mitochondrial DNA, which comes from your mother, or from the parent's regular DNA. Because the mitochondria is used to supply energy all over the body, it can hinder a lot of the functions that we have and have a wide variety of effects. Wait, do we need a little thingy now? I don't know. How do you use it? Just push the button. Okay. Wait, Kaylee, come up here.
Says they cannot hear us. What happened there?
Fantastic. No, we aren't on mute. Yeah, I did it.
Hold on, it is the classroom.
Should have done a tech check for this.
No, we did that before. I was
Oh, she
talking.
can hear now.
Can you hear us? Kiara, can you do a thumbs up?
It doesn't sound on, right?
I don't think that one.
But they're nodding. Yeah, okay.
This should be, when you press it on, it should be on. You don't need to press it again.
Do I have to hold down on
No,
it?
no.
Just hold it? Okay.
If I do that, can you hear now? Okay, okay, go ahead then.
Go
Just
ahead.
speak.
Just talk?
Uh-huh.
Yeah. Okay, so 1 in 5,000 individuals have a genetic mitochondrial disease. And then each year, about 1,000 to 4,000 children in the United States are born with a mitochondrial disease. And typically mitochondrial diseases are going to affect the organs that use the most energy in your body, which is your brain, your heart, and your muscles. And then some symptoms include poor growth, vision and or hearing problems, so like blindness or deafness, learning disabilities, delays in development in like younger children. Kids can be on the autism spectrum disorder, heart, liver, or kidney diseases, diabetes, thyroid problems, respiratory problems, and usually in older patients, dementia.
No.
Take check there.
Oh, okay, sounds good. I don't know who that
All
is.
right, this one's fine. All right, so is there a treatment? There is no known medicine or therapy available specifically for mitochondrial diseases. However, there is a lot of research being done right now. Clinical trials and research are currently underway for gene therapy, medications, and other forms of therapy. Trials currently in process range from phase 1 to phase 3. Notably, there are trials in phase 3 for a coenzyme Q10, which is an oral drug, GS10 gene therapy, and then dichloroacetate, which is a drug for treating congenital lactic acidosis, which is a specific kind of mitochondrial disease. This is also mine. So the UMDF has certain roles that they have for all these different kinds of things they do. One of their biggest ones is research. They're the top funder for mitochondrial disease research, having funded 125 labs and having given away over $12 million in grants. Along with this, UMDF also works to create a registry of patients through a program called MitoShare. It provides clinical trial information to patients and connects patients with clinical trials, and it helps families find a diagnosis, which gives us more patients for clinical trials.
Okay, so for advocacy, UMDF provides a whole bunch of different things that promote mitochondrial diseases, but one of the main ones is a MitoMed conference. So this brings together the best minds in mitochondrial medicines and the patients that they do serve. From this, it gives patients and families the opportunity to meet some of the top clinical mitochondrial specialists from around the world. And then at this conference, there's a mix of education-based sessions, as the MitoDoc, panel discussions, social events to meet and connect with other people who share your journey. And this year's conference is going to be held in Phoenix, Arizona. UMDF also has a Powerhouse podcast, which CEO Brian Harmon and UMDF Science and Alliance Officer Dr. Phil Yeski. What is it? Oh, chat with interesting people in the mito community just to bring awareness on the topic. And then also UMDF has a Congressional Mitochondrial Disease Caucus, which develops congressional supporters and champions on the issue that impact their community. From this, it helps amplify the patient's voice and educate policymakers on Capitol Hill, which UMDF has visited. And then throughout their website, it's volunteer, give, and spread the word is very like bold and vocalized through everything to spread awareness. And then also in advocacy, there is Become an Advocate Today, where you can sign up and help raise awareness on this issue.
All right, so another role of the UMDF is support. They provide support through patients, support groups between patients, virtual meetings due to COVID, and also for a better connection around the country so more people can connect with each other without having to travel. And also a phone line patients can call, which is noted down here. So we have our ideas for the project, and the UMDF asked us to talk about traveling issues with all the equipment and stuff that a rare disease has to come with it. So what can we do to make travel easier for patients? So we decided that adding a page to the UMDF website would be a ideal situation, or ideal idea. So on this, it would have useful travel information such as prices, safest way to travel with their specific equipment, hotels close to facilities, and optimal hospital transport. Also, we would have a patient support page, having like some, sorry, my brain's not working. Having advice from patients and what worked best for them and their stories from travels. And then also having a checklist of things to bring besides the obvious needed equipment like identification and proof of insurance. So we talked about masks, plugs for your ears, chargers, emergency information, prior treatment documentation, just in case you're switching to a facility that doesn't have your records and the prior hospital is unable to send it over. And we're just trying to make sure all the boxes are checked. And I think we missed a couple slides because Kaylee doesn't have hers up right here.
Okay, so UMDF's mission is to promote research and education for the diagnosis, treatment, and cure of mitochondrial disorders, and to provide support to affected individuals and their families. How do you do that?
That works this way. Oh, back. There you go.
Okay, so for
Wait,
the.
No, that's not it.
it's
Where
in this
is
one.
it?
There.
There you go.
Okay, so for education, the UMDF has what's called Mito University, which has lots of resources and videos about Mito and provides answers for their patients 24/7. They also have a monthly webcast. One's called Ask the Mito Doc, and it's for patients to collaborate and ask lots of questions. And then they have the Bench to Bedside, which is for doctors to collaborate on new ways to treat mitochondrial diseases.
All right. And then any questions for us?
So any questions for this group? Eugene? So are you able to make any similarities with the group that you work with and where UMDF is? So UMDF seems to have all different aspects of their mission covered, so you know what their mission is. And some of the organizations that you'll be hearing from today may be pretty new, they may be small, and they may be just starting to develop like the advocacy or all the what do you call education and all the other research stuff, whereas UMDF seems established. So for your project, are you going to interview people, or how are you going to get the facts? So if you go back to your digital graphic, that slide. So you said you travel prices, safest way to travel with equipment and all that. So are you going to do research like online, try to find what is needed, or are you going to talk to people? How are you going to go about
We're gonna
that?
do just a little bit of everything, just kind of get all the bases
Yeah.
covered.
I think a big benefit will be interviewing with actual patients so we can hear their experiences and work with that.
What worked and what did not work,
Yeah.
and what care needs to be taken? Great. And any, like, is when you say digital graphic, is it just like a
Just like a page
one page?
Mhm.
Yeah.
Okay.
or like a little thing in the corner that they need.
Okay, but for your final presentation, if you want to use any of the facts you got from the interviews and stuff, you can include that in your final project presentation. If you're not going to your project as such, but you could use
Okay.
those clippings or quotes or whatever from those interactions so that others can learn from your experience. Any
Okay.
questions for this group? Okay, thank you. Next is organic acidemia group. Any, oh, I didn't ask you, Anne or Tara, any questions for the students?
No questions. Thank you very much, Blue Jeans. We're excited for this project. It's as Margaret and I think explained to them, it's a significant barrier for moving trials and research forward, and something that we think will be of significant benefit for our organization. So we're excited about it.
Yes, thank you. Thank you. Thank you. And great job, Team Blue
Yes,
Jeans.
great job. Mhm.
Okay. So you are, yeah, go ahead. This one, Babinski group. Present, do you want to, okay, you can control the, yeah. Okay, but let me see where my Zoom screen is. It's funny because I'm not sharing yet and it's sharing my desktop also. if you want to move this around, you can.
Okay.
So this is Group B, Babinski's. And they're going to talk about their interaction with Organic Acidemia Association. You just
Oh,
click
okay.
there.
No space bar. Click. Okay. Good morning. We are the Babinskis. We're working with the Organic Acidemia Association.
Can you hear her, or should she be louder?
You can hear me? Good. Okay. And organic acidemias are a group of rare diseases that are categorized by an enzyme deficiency that causes the buildup of organic acids in the blood and urine. The acids build up because the enzymes are not functioning properly and the acids cannot be broken down. And just a biology recap, enzymes are proteins that speed up metabolisms, and one of their most important functions is to aid in the digestion of foods. And then lacking or not having enough of a certain enzyme can cause waste products, organic acids that should have been broken down to accumulate in the body. Should I admit the person from the waiting room? Okay. And then the buildup of organic acids can cause severe brain, liver, and kidney damage. However, symptoms can vary from one organic acid disorder to another, or even from person to person. And then organic acidemias are inherited disorders and are autosomal recessive, meaning that both parents need to be carriers of the recessive gene in order to have a child with the disease. Currently, newborn screening is available for at least one type of organic acidemia in most of the 50 states. And then I'll go over a few of the classic organic acidemias, meaning the most common. And I'll go over 3: PA, MMA, and IBA. They each result from the deficiency of a different enzyme, but some are associated with the same catabolic pathways. So PA stands for propionic acidemia, and it's due to the absence or deficiency of the enzyme propionyl-CoA carboxylase, which is involved in the breakdown of the amino acids isoleucine, valine, threonine, and methionine. And then symptoms usually develop within the first few weeks of life and include vomiting, diminished muscle tone, dehydration or poor feeding, and seizures. And then MMA is methylonic acidemia, which is caused by the deficiency of the enzyme methylmalonyl-CoA mutase, which is usually accompanied by something called a decomposition event or a metabolic crisis, which can occur at different ages and usually has the symptoms: trouble breathing, vomiting, lack of energy, and poor feeding. And then IBA is isovaleric acidemia, which is caused by the deficiency of the enzyme isovaryl-CoA dehydrogenase, which is the enzyme responsible for the breakdown of the amino acid leucine. And it causes acute attacks characterized by vomiting, refusal to eat, listlessness, and abnormal lab values, and a sweaty foot odor. Acute attacks can present in infancy or later childhood.
So while there are not,
Yeah.
while there are not many curative treatments right now for organic acidemias, since there's a defect in protein metabolism, a specific diet is very important in keeping the symptoms in order. Some of these include high carb and low protein, and some babies can get low protein formulas. In addition, most of these patients take supplements, and most of them take L-carnitine, which removes toxic substances from the body and makes energy. Some take biotin, which helps the body break down food. Some take glycine, which is a proteinogenic amino acid. And some take riboflavin, which aids the body's ability to use protein, and B12 as well. The cell needs an adequate amount of vitamin B12 to be able to metabolize. And since there are each of these disorders are characterized with a different enzyme missing, everyone has to take different supplements. In addition, it's sometimes necessary for people with severe symptoms and acute episodes to get liver and kidney transplants. For babies who cannot eat as well. There's nutritional fluid therapy, and if there is extreme symptoms, there's hemodialysis for the PA disorder, which helps remove excessive waste through an artificial kidney machine. While there aren't many curative measures, there is hope for the future, as there is a gene therapy potential for PA in Australia, which aims to help young babies by fixing the liver genetically instead of using a transplant. In addition, Moderna is also conducting a phase 1 to 2 mRNA clinical trial for MMA, hoping to increase the MUT in the cells, so the buildup of harmful substances in the liver and blood that results in the symptoms is lessened.
All right, so we heard Nancy and Bella talk a little bit about the disease as a whole. So what is the Organic Acidemia Association trying to do? What are their efforts in trying to solve this issue? So Organic Acidemia Association has been around for more than 30 years. It's a very well-established organization. And it's because of that, it's worldwide. And they have patients from around the world who, come to their conferences, do whatever to know more about it and potentially get answers to what they can do about it. So essentially what the mission statement of the OAA is it's a volunteer nonprofit organization focused on empowering families and healthcare professionals with knowledge in organic acidemia associations. And like Nancy said, one of the things that they're really proud of is that they've helped to enforce newborn screening of various degrees. Some states have more than others, in many of the states, and that's something that has been a really big push for them and something that they've seen come to fruition, which is awesome. In addition, they get contributions and distribute those funding to support research towards improved treatment or cures or possible cures for the disorder. Along with that, they're working with many different labs, Moderna one of them, with 4 possible treatments entering clinical trials, plus a couple in phase 1, phase 2, and others that are getting researched as well. In addition, there is a Dr. Chuck Venditti at the NIH, who's really in a really critical role in studying the disease, the effects, and possible treatments. And he's kind of the spearhead for their research efforts. Challenges of the association. There are 21 different types of organic acidemia. We only kind of covered 3, but having 21 types is a lot of different variations. And having one organization to kind of umbrella all of those types is something that's more of a challenge because they're different symptomatically, they're different genotypically, and it's just hard to get that as a whole. And along one thing that Kathy told us in our Zoom call is that, she's really the one person that's heading all this, and she doesn't really have a ton of people under her. So having that, one effort in the 21 types, it's a lot of work to try to organize. In addition, they're trying to increase general knowledge and awareness of rare diseases, most importantly to them, organic acidemia, but others as a whole. And then they also organize conferences and events with families that are useful to those with various types. Like I said, there are 21 types of organic acidemia. And then there's also an NIH study that's going on right now about organic acidemia. And they're looking for volunteer individuals with organic acidemia to get involved in that study so they can learn more about the disease and possibly get treatments, cures, etc.
All right, so barriers to care for OA are very similar to other barriers to care for other rare diseases. A big barrier is just lack of overall knowledge within the medical community. Doctors don't know how to treat the disease. They don't know how to identify it. So it's just very difficult to get a diagnosis, which comes into the second barrier to care, misdiagnoses, which are also very common, and they take a lot of time to diagnose diseases. And often with rare diseases, patients don't have much time. So the misdiagnosis leads to just a setback in the care process. Another large barrier to care would just be lack of overall community awareness and size, which affects the decisions of pharmaceutical companies. When communities are small, they just have less power and just less of an ability to just raise awareness. And then the cost of medical care and insurance is always a big issue. With rare diseases, treatment and testing is always going to be very expensive. And for OA, there is currently only one treatment available, and it's a protein formula. So treatment is hard to get.
So in terms of our final project, Tim mentioned some of the challenges being that they want to increase awareness about OA, and right now Kathy's working really hard to have conferences and inform people, but we think that we can really utilize social media to inform more of the younger generation as well as the older generation to incentivize them to donate to OAA. So first, we really want to create a document, or we plan to create a document that can help OAA and Kathy in using social media. So how do we use Facebook, for example? How do we use it effectively is probably the most emphasized part. And then how do we most effectively use Instagram as well? So those are going to be our two social media platforms that we will focus on. For Facebook, our outreach will focus a lot more on fundraising, because Facebook composes a lot of the older generation who can actually have money to fund OAA, as opposed to Instagram, who are a lot younger. And so that will be used to inform younger generations, like people my age, about what organic acidemia is and how they can help, and different ways that they can be an advocate too. So like I said, Facebook will focus on a lot of the fundraising, as well as include, some interviews and what it is, just so people know what organic acidemia is. And then Instagram, we also will include interview reels with Dr. Vendetti, like Tim had mentioned. He's kind of the spearhead for OA. And so we want to get an interview with him, as well as get a few interviews with different patients as well that have different types of organic acidemia. We're looking to focus on the 3 or 4 main types of organic acidemia and interview them personally. We also want to post about what is organic acidemia, what are the different types of organic acidemia, how many types there is. So really, again, just educating the masses, as well as we also want to post about different progress that OAA is making towards, improving like different conditions in it, and just so that they can feel connected to what OAA is doing and how it's going for everyone. And then also how they can help as well will be another part that we'll post. So I took some of these pictures from Instagram, of like an educational Instagram account. And so this is kind of what like the setup will kind of be like. We won't necessarily copy this, but this is what what the layout will look like. So for example, we'll define what exactly is OA. So if you see here, what are accessibility rights, it'll be like, what is organic acidemia? And then what are the different types and how does that affect people differently? And then we'll also inform people about the history of organic acidemia, such as like when the first case was found and different milestones that they've reached and the progress that we are currently making. So, and then we'll also be sharing milestones and when OA makes significant progress in organic acidemia. So if you look at the 2 left pictures here, that's kind of what we're envisioning. And then lastly, we'll post interview reels. So the one at the top right here with the face of the lady, it'll look kind of like that. We'll just show a picture of what the patient looks like, so they clearly know who they are, what their name is, as long as that's okay with them, of course. And then the next slide, if they were to swipe over, they would see that interview that we would conduct with them. And it would be a more personal interview, so that people understand like these are real people with like a real disorder, and that it's really important to them and it's important to us as well. And lastly, I also said that we wanted to get an interview with Chuck Vendetti or Dr. Chuck Vendetti. We hope to get a couple more interviews, but that's what it's currently looking like for our final project.
So a little over time, so but any quick questions for B? I'm sure you're getting ideas from what they have laid out, how you should be doing your project. Is it something similar?
Do you guys have any questions at all, Kathy, anybody?
Thank you so much.
No, I think it looks great. Thanks, Team Babinski's. This is an area of social media that I haven't been able to focus on much, and probably, don't do it justice as far as, taking it from a younger youth perspective as far as what Instagram, how to kind of work that into to a program that could educate. And so I think this is awesome. So I look forward to it.
Awesome.
And Kathy, I would suggest the students to maybe, when they have questions for the interviews and all that, maybe they should first send it to you. Would that be okay for you?
Yes. Yeah, I'll connect them with.
Yeah, I mean, not only connecting, but also like making sure that the questions are vetted, like whatever questions they come up with. I just want to make sure that it's accurate and it's not misleading, whether it's to the patients or to the doctors and things like that. I will also look at them, but if you have the time, it'll be great if you can vet them as
Sure.
well.
Yeah, we've connected on email, and so they
Sure.
know how to get a hold of me. So
Yeah,
Yeah, just
and
let
that's
me know.
where I've told them to share the Google Doc so that you know what
Yeah.
kind of, so you can put them all on the Google Doc and just make sure, update it and let her know that it's there.
Okay.
Thank you so much.
Yep,
Thanks,
thank
Kathy.
you.
thank you.
And now Yaya Foundation. I know Christina, thank you so much for joining. I'm going to have them speak now. And in case you need to drop off and before they end, that is fine too.
I will stay on. Thank you for having me.
Sure. Okay, let me pull up their slides. Share. Yours is chasing a zebra. Okay. We just have to check here, okay? Okay.
Wait, I can't see myself of like, I don't know if I'm in the camera or not. I mean, I guess I am, but.
You are, but I just have to share again, I think, for some reason.
Okay, there.
Share. Okay, now you
There we
can.
go. Okay, now I can see.
So let's do present. And in case it's coming in your way, you can just do this, minimize it so that it's just looking at yourself.
Okay, yeah.
You won't see others, but if you want two people,
Okay.
all of them, you can just.
Okay, perfect. Good morning. We're Chasing Zebras, and we are working with the Yaya Foundation for 4-H leukodystrophy. Oh wait, oh no. Oh, there we go. We're gonna start off with Yaya's story, who is Yaya Garber, who the organization is named after. Yaya is a 4-H leukodystrophy patient, and her parents, June and Ron, are one of the founders of Yaya Foundation. It all started with early concerns in Yaya's development. Her milestones weren't getting met. She wasn't smiling. She was experiencing poor motor skills, feeding issues, and severe weight loss. And obviously this caused a lot of concern for her parents, and they were really worried about her and were taking her to doctors and specialists, but were often dismissed by their pediatrician. But in this search for care, they asked to see a neurologist, in which they conducted an MRI, but this MRI was normal. And it ended up not being normal, but the MRI tech that performed the analysis on it didn't know how to read the specific abnormalities that it showed. So they continued on their search for care. They conducted more genetic tests, more specialist visits. And she was having, at this point, very severe digestive gastroenterology issues. And so they sought to see a gastroenterologist. but the wait to get into the gastroenterologist was 6 weeks or more, which they knew that that was not an option for them, that would be way too long to wait. So they were calling every day, trying to get in, and they finally got in. They performed a swallow test in which she failed that. So she was admitted to the ER and had lots of surgeries, operations, had a feeding tube placed. And in all of this craziness to get diagnosed, they got her out of the ER after all of these surgeries and everything, and they felt very lost. They didn't have a diagnosis yet until finally a geneticist did end up diagnosing her 4-H leukodystrophy, but he did not have the adequate information to tell them about the prognosis, or didn't really know anything about the disease. And they kind of left the appointment not knowing what to do next and turning to Google and searching by themselves and trying to find care on their own. And this whole story kind of inspired them to start the Yaya Foundation to kind of bring together families that shared very similar diagnosis journeys to them.
Okay, so now that everyone has heard about, sorry, I gotta make sure I'm in frame. Now that everyone has heard about Yaya's story and her journey with her diagnosis, you're all probably wondering what even is 4-H leukodystrophy. So 4-H leukodystrophy is a rare disease of the central nervous system, and the 4-H's stand for hypomyelination, hypogonadotropic hypogonadism, and hypodontia. And you guys in the classroom probably have no idea what any of those words mean. I didn't when I first heard of them, so I will just give a brief overview of each of those. So hypomyelination is a lack of myelin in the central nervous system. Most of you guys took AP Bio or some other biology class at some point, and you probably remember the myelin sheath, which assists in transmitting electrical signals along the nerve cell. So this lack of myelin inside of the body prevents the central nervous system from sending out these electrical signals to the rest of the body. Hypogonadotropic hypogonadism is delayed or abnormal puberty, and this is caused by the central nervous system's inability to initiate puberty. And lastly, hypodontia are abnormalities in tooth development, and in some 4-H patients, there is no tooth development at all. And these 4-H's are the main symptoms of 4-H leukodystrophy, but there are some additional symptoms which are present in most 4-H patients as well. One of these is motor issues, which eventually leads to ataxia. And ataxia is a group of issues relating to coordination, balance, and speech. And eventually, after suffering with ataxia, most patients will completely lose their ability to walk. And the last symptom that most 4-H leukodystrophy patients experience are difficulties swallowing, which was mentioned in Yaya's story. And this leads to problems with both feeding and with breathing, which is clearly a very big issue. These conditions get progressively worse over time in all 4-H leukodystrophy patients.
Okay, so I thought I would start off with just some normal like presentations of 4-H. So they all present very differently, but the disease is always progressive and life limiting. But most cases present with early childhood motor clumsiness. So just like not being able to do what they should be doing at a certain age. Also like dental abnormalities, kind of like what she just talked about, and endocrine problems. So endocrine problems usually happen in like the later development, so like older kids, but they can happen too. So general diagnosis, MRIs are usually what catches the disease, but kind of like what Sophia talked about, they're usually misread, which causes a lot of issues. So since the disease is progressive, it's really hard to catch on the first one. So they would have to be taking like several MRIs, which usually doesn't happen. The disease can also be diagnosed through genetic testing, which is usually kind of like what doctors prescribe last. So that's why the diagnosis takes so long. And then there is no current treatment for 4-H right now, a lot of doctors will prescribe different medications to treat symptoms so they can improve the quality of life. But I believe they are working on like gene therapy and most like other different clinical trials. I don't think any clinical trials have been started yet, but I think they're working towards them. Yeah.
So this is just like the challenges of 4-H leukodystrophy. These are kind of discussed, but just wanted to reiterate them because they're kind of a big deal. So the symptoms get progressively worse over time. And then patients with 4-H leukodystrophy suffer with motor issues, which can cause the loss of ability to control bodily movements. And then they can also develop difficulty swallowing, which then leads to difficulty eating and breathing. And there's no known cure, which is hard then to treat it. Even though they're able to lessen the symptoms, they can't really treat it.
And some focus and goals that the Yaya Foundation is trying to do are fighting for children affected by 4-H. And to do this, they're in search of a therapy which needs more money, which means they need more money. And to do this, they need more fundraising. And they provide emotional and educational support for families and patients affected by 4-H. And they're also trying to build a roadmap to align a collaborative team of people with many different backgrounds to collect data on 4-H.
Some of our project ideas, well, we were thinking about going the more product design route. And this would first start off with identifying patient needs. There's obviously a lot of challenges that patients face with 4-H. And we would love to talk directly to families or patients, identifying those specific struggles and problems of people living with this disease that doesn't currently have a curable therapy, and how we can best try and figure out what either products that already exist or something that doesn't already exist, and how we can improve their quality of life. Like I said, conducting market research on existing products to try and fit those patient needs and or family needs. And then also maybe creating guides and lists of helpful products or helpful services to help patients manage symptoms and help families manage their diagnosis journey, and perhaps creating an Amazon wish list fundraiser where people can very easily donate to families that are in need. And then our last slide is just a quote that we took from our great presenter, Ron, who we got to talk to from 4-H leukodystrophy, or from the Yaya Foundation, that no one should have to rely on luck or good fortune to receive care.
That's a good one. That's a really good one. So let me pull this up. Any questions for the group? Thank you, group. Any questions? So you're learning about a lot of different diseases today. So hopefully you need to go back and check on if you have any outstanding questions. Either you can ask them or they can find answers for you, or you can do the research and find those answers. But I need questions. You're learning about new diseases, but so you need to have questions. Christina, anything for the students?
No, I think, first of all, I love that you've named yourselves the Chasing Zebras. It's so apropos. You guys did a great job and sort of, articulate itself. But what I would say is, I haven't been here the whole time and I can't stay the whole time, but I'm sure that the other leaders on this call, that our barriers and our challenges are similar, and stories are similar, even though our diseases are rare and unique, us face some of the same. So thank you for taking the time to focus and support the leukodystrophy community. So thank you.
Yeah, and Christina, I think if you can introduce yourself, because they have only met Ron. So now you would be the first point contact, or should they be contacting Ron?
No, that's right. Stick with me if you would. I'm the executive director. I had a scientific seminar last week with a global audience of researchers. So I apologize, I couldn't make it last week, but please, and Ron is our founder and his daughter is who passed away at 15 months from the disease. So, but he has a day job, so this is my day job. So please feel free to reach out.
So what I'm thinking is for their project ideas, as you saw, that they may need some guidance, like how to go about it. So they're going to share like a Google Doc with their ideas
Perfect.
and what they need to do. And feel free to offer your comments, because that would be a live document. That's how they can interact with you the most. And of course,
Perfect.
emails and other things.
Okay, great. Thank you
Group
all.
C. Nice job. Last group, sickle cell anemia. Let me pull out your slides. You are. Yeah, I'm assuming.
Yeah.
Okay, good. You want to move this around? This is how, and then just click this button to move forward. Okay.
Does anyone need like speaker on the bottom? Oh. Good morning, everybody. We are the Disease Destroyers, and we are partnered with the Sickle Cell Foundation of Minnesota. So what is sickle cell disease? Sickle cell disease is actually one of the more common rare diseases. It's an inherited blood disorder that can cause like a normal red blood cell to become misshapen into the sickled shape. And these sickled red blood cells are often more rigid and stiff, and it makes it hard for them to pass through these. Oh, go ahead. Oh, sorry. Go ahead. And it makes it hard for them to pass through like small blood vessels without bursting. And so these sickled cells often die early, which causes a shortage of red blood cells, which is sickle cell anemia, and can also block blood flow, as you can see like in that image, and that's called sickle cell crisis. So, and then when these blood clusters get big enough, they may cause episodes of sudden, really intense pain called pain crises. Infections, pain, and fatigue are very common symptoms experienced by individuals with sickle cell. As I mentioned before, sickle cell disease is inherited, blood disease, but it's inherited in an autosomal recessive pattern. Sickle cell trait means an individual has inherited one copy of the gene mutation, and sickle cell trait individuals often show no symptoms. So that's why it's important that not only newborns are screened for sickle cell, but people are also notified if they are carriers of the trait. Okay, so in the US, sickle cell disease is a routine part of newborn screening. Even though it is a part of newborn screening, adults and children are also able to be tested. It is a blood test. So in adults, it will be taken through a vein in the arm. And then for children and babies, it will be taken by a heel prick in either the finger or a prick in either the finger or the heel. This blood test is to check for a defective or abnormal hemoglobin. A hemoglobin is a protein in the red blood cell that's responsible for transporting oxygen to your body's organs and tissues and transporting the carbon dioxide from those organs and tissues back to your lungs so it can be expelled out of the body. Another test that's not super common, but is a test nonetheless, is amniocentesis, or an amniotic fluid cell DNA test. This test will be performed typically 17 weeks or later during pregnancy. So it is a prenatal test, which is during pregnancy and not after birth, like the newborn screening is. And during this test, a physician will go in with a large needle, take about 20 milliliters of fluid, and that should have enough amniotic stem cells to send over to a test to be DNA tested, or send over to a lab to be DNA tested to see if the child will be a carrier or even possess the disease itself. For managing and care, management is typically aimed just to avoid those pain episodes or crises, relieve symptoms, and prevent further complications of the disease. These treatments include medications, transfusions, and transplants. All these medications listed on the board, which are very difficult to say, are all in general pain relieving medications. They're all just prescribed to help ease the pain in those pain crises, or even help to avoid them or lessen the symptoms that you are experiencing. And then where it does say pain relieving medications, that's just your typical aspirin, Tylenol, acetaminophen, but they are a stronger, heavier dosage. So you have to be prescribed them. You can't just buy them off the shelf or over the counter.
For children ages 2 months to at least age 5, receiving dosages of penicillin is crucial in helping to fight off infections. Like she mentioned earlier, infections are a very common symptom in people who possess the sickle cell disease. Another way to help fight off infections is receiving vaccinations. This one is also for adults. Penicillin is typically just for children. The vaccinations include pneumonia vaccination, meningitis, and the flu vaccine. Another way to help fight off or to help treat this disease is through blood transfusions. So they will go in and take a sample from a healthy donor of blood and filter out their red blood cells and transfuse them into a patient who is suffering with sickle cell disease. And that will help them to bring their red blood cell count up because this disease does kill off red blood cells faster. So this blood transfusion is just to help bring up their red blood cell count and also help bring in healthy red blood cells so that those can reproduce into more healthy red blood cells instead of the sick red blood cells that will effectively like mutate and become more bad blood cells within the body. And our final option for treatment is stem cell transplant or a bone marrow transplant. This is because the bone marrow is also affected within the body and it causes your bones to deteriorate and basically disintegrate within your body, which is makes it easier for them to break and the bone basically to disappear within your body. So you'll just, like the blood transfusion, you'll take a healthy bone marrow sample and transplant it into someone who has sickle cell disease. It won't regenerate the bone and it won't make it as good as new, but it will help it from deteriorating even more and worsening the symptoms. One quick little fact about sickle cell disease is it actually originated as a mutation to fight against malaria. And because malaria thrives in the tropics, the common mutation in the HBB gene are found in people from African, Mediterranean, Middle Eastern, Indian, Caribbean, and central parts of Central and South American ancestry. So this disease really can be found in any ethnicity.
All right, this is kind of just a segue to future information we'll tell you about. But as we know in this class, we kind of lack that rare disease education in med school. And this is actually like the one section in a med school textbook that I found that relates to sickle cell anemia. And there was a survey in 2015 that basically found that only 20% of doctors feel comfortable treating sickle cell. And we're going to talk more about the disproportionate disadvantage having to do with like where you mostly find this disease later, but it's important to keep in mind that it is a blood disease, not a Black disease. And I also provided some ways you can look and educate yourself through social media that we currently have.
Okay, so since the disease comes from a mutation from malaria, sickle cell is usually attributed with only African Americans, and that's actually just not true. So because of this racial bias, medical care becomes affected, and I think we all know that there are some, just unequal opportunities in the medical care field. So because of this too, Caucasians tend to ignore their positive results or even their trait results, just because like we all think of it, well, not we all think of it, but we all have that tendency to just see like these pictures of people who suffer from sickle cell and they all seem to be African American. Yeah. And so with that too, there's a huge pain bias because obviously sickle cell is associated with just moderate to severe pain. So opioids are highly addictive pain relievers and they are prescribed to those with moderate to severe pain. Anyone can develop an addiction to opioids. It's not just an African American thing. That's also a big stigma in our society. And then since sickle cell is associated with severe pain, opioids and other pain relievers are a very common prescription. And it's because of these rising opioid overdoses that opioids are very hard to acquire and they're very hard to prescribe, even though they are the most effective option. But health centers and researchers are really working towards discovering other drugs that can safely wean people off of narcotics while still like effectively managing their pain. Right now, the biggest one I found was buprenorphine, and it's actually another opioid, but it's used to treat opioid withdrawal symptoms.
All right, so I provided some statistics here that can just kind of show you, while it is like a really like more common rare disease, it is rare. So with this and kind of the lack of treatment that comes with rare diseases, there are actually 350,000 deaths per year that is found right now. That's like what we know. I don't know.
Is this a global thing?
Yes, this is a global disease. So like around the world, that's what we've been able to find, but like with the lack of, general connections. So there is a map. We kind of talked about how it's mostly found in like Middle Eastern and African countries. So the top three, I'm not sure if it actually goes in this order. I believe it does. It's Nigeria, Congo, then India. And I provided some more statistics on like which ethnicities are kind of found to have this in relation to others. You can see that. I feel like reading it off is kind of excessive. And then the mortality rate since 1979 has risen 1% every year. I think it's also because we only have one active treatment. Oops, sorry.
So we had the privilege to work with Ray Blaylock. She is the president, founder, CEO of the Sickle Cell Foundation of Minnesota. Some of her other roles that she serves besides, the president and CEO, she's a certified community health worker. She's a certified hemoglobinopathy counselor, just deals with red blood cell disorders. She's a sickle cell patient family health advocate at some local children's hospitals. She founded this in 2012 and became a nonprofit in 2015. It is a community-based organization that's comprised of patients, caregivers, trait carriers, health providers, advocates, and other individual stakeholders. Their main mission is to improve the quality of life for individuals and communities affected by the sickle cell disease and the sickle cell trait. And they strive to connect individuals and families to medical providers to help provide extra resources to address barriers to care and help improve overall quality of life. So how can we help with sickle cell? Obviously, we can donate money to help advance treatment and research. One of the main things that they are really pushing for right now is blood donation. Donated blood can be tested for specific antigens that are essential for treatment. A wide variety of multicultural / ethnic donors, obviously, but it's not limited to, can provide better matches for blood types and characteristics. As we talked about before, at least in the US, it is predominantly found in African-American people. So by getting more African-American people to donate blood, it's easier to find a match to help treat patients with sickle cell disease. Also, donating blood marrow is one of the newer things that they have found. Bone marrow. Bone marrow is the only known cure for sickle cell, and we use that term loosely because it does not eliminate the sickle cell trait. It basically only helps with your symptoms and your pain management, but does not get rid of the trait.
We didn't really include a slide on like our ideas of solving this or like kind of,
We can talk
of
about it.
We
contributing.
can just mention it.
So,
Yes.
so
Yeah, it's all of the names.
Just a second, I can
Yep.
just stop sharing so that you can see Ray and there, that is Ray, yep.
We talked about a lot.
So, okay, over here, so we're on the camera. Some of the main things that we had talked about for our project are some of them are media, are strongly media based. So one of them would be creating a billboard that would, kind of create this image of helping people with sickle cell disease and the promotion of donating blood and bone marrow. That also, we could also do infographics that would also educate people on, again, the importance of donating blood and bone marrow. We talked about hosting a blood drive that would help us gather the resources such as amounts of blood so we can, use to help treat patients with sickle cell, and talked about maybe finding a role model / endorsement, or setting up a booth and creating stickers that would say more about these issues and things such as, again, the importance of donating blood and bone marrow. We're really trying to strongly emphasize that because that is definitely a strong need in the sickle cell community right now.
So I guess you may want to narrow it down because you may not be able to do all of it in the next 2 weeks, but you can integrate them. Like whatever resources you get, you could apply for multiple things. So work with Ray to figure out, like maybe it's 1 or 2 interviews you do that you could use for either the infographic or the billboard or something, like some ideas that you get from that, like a punch point or some quotes that you could use or something like that. So work with her. All are good ideas, right, Ray?
They are all wonderful ideas, and you all did a wonderful job of investigating the background and better understanding the plight of individuals with sickle cell disease. So I'm very excited about what's next.
Thank you so much, Ray, for your time. And I know you have another meeting, so I'll let you go. Thank you all for joining. You will have to be here till 11. You have more things to do for the rest of the class, but for the advocates, thank you so much. See you later. I'll be in touch with you. Bye-bye. Did anybody say something?